Neck pain, dizziness, back pain, shoulder pain. Yep, I saw it already. You have nystagmus. This side's not as bad?
I thought it wasn't.
We're here with Chris today. Chris took the ride from New Hampshire, scheduled himself online, showed up with some neck pain, dizziness, back pain, shoulder pain were the primary complaints. Some other stuff too. This is visit 2. So I adjusted Chris yesterday, found out that he was only in town for 1 day, so I forced him to come in an hour early before I start my day. I haven't been at the office this early in over a decade, actually. Yeah. But when you're coming from New Hampshire and you need and deserve the work, then it's an obvious choice. So, all right, so we're here for visit 2. So how did you feel after visit 1? Tell me about what happened after the
Yeah, so went to the hotel, sat down, ended up passing out, great sleep, woke up. My foot, which I even forgot to mention, was in pain yesterday, is completely gone. It's great. I had stepped on it awkwardly a couple days ago. My lower back's a little sore, but it feels good. Like I was telling you, it's an oxymoron. It's sore but good. My left shoulder feels much better. Headache's gone, which is awesome. I rarely have days without headaches, so it's great. I mean, compared to yesterday, definite improvement.
Okay, cool. We had a deep dive into the vision and to the dizziness. The vision and the dizziness symptoms, which have been there for, let's go back now. I mean, you were in high school lifting weights?
So the high school, no, the weightlifting started, that was the omeprazole and stuff. So the dizziness and stuff started about 3 years ago.
Okay, thank you. Oh yeah, thank you.
Yeah, right, yeah. And then I was literally lifting weights when it started. I was doing a bent over row, and then all of a sudden it just went. So, but it's been going on for 3 years, and rarely do I have days without headaches, and I feel good. Like I still have the dizziness a little bit, but like no pain whatsoever. So
very good. All right, we're gonna dig in a little bit deeper with the dizziness today with some cranial, and we're gonna do some vestibular work as well. And then, so the other thing that was interesting is you've been on omeprazole or some kind of antacid or digestive aid for a long time. You've had almost lifelong heartburn since childhood.
Yes, sir. Yeah, since I was 13, 14, basically high school. When I started high school is when I kind of got on it. They've done everything. They've done the scope down there. They haven't really found anything. Tried it without, tried natural remedies, the whole shebang, and nothing.
Okay. All right, here we are. So we're going to dig in. We're going to do some more cranial, vestibular, and some gut stuff today. We did a lot of musculoskeletal stuff and yesterday, so we're going to go a little bit deeper now. All right. I don't have any pre's from yesterday, but we've got the high shoulder, right side, so we're going to do some rib torque as well. High right shoulder, high left ear. Looking at the glute folds here today, lower on the right, same as yesterday, and then higher left hip. Let's see. Okay, so yesterday we had a high right ear, so we've actually changed the tilt angle of the occiput and the entire cranium. That's good. Go ahead and close your eyes. Yesterday we had lateral sway, indicating category 2. There's some backward sway, forward sway, backward sway, forward sway. No lateral sway to speak of here. Okay, you can open your eyes. So we've definitely reduced from a category 2 to a category 1. We did Logan on the left, so we'll do that. And we have some neck occiput stuff to do that we did yesterday. Okay, start off. Lie on your belly, please. I'm going to check the coccyx, the tailbone here. Right. Good. Still a little bit today. All right, I'm going to lower this down just a little bit so I can access this ligament here. This was tender yesterday. Third trap fibers, tender again today.
Nope, not at all, actually.
Awesome. Okay, now, we were very cracky yesterday, and there's still a little bit here left today. That's okay. Reset after the night. That's perfect because that's what muscle memory does and is. And the crack is more of a stimulation than the remedy itself. You know, the crack isn't necessarily the medicine. The motion is the medicine. Things have been stuck for a long period of time, and when things are stuck, it changes and alters the way that the nervous system is communicating from the brain to the body. That's basic chiropractic 101. It's all about the brain to the body connection. And when the spine is stuck in certain places, it changes the signal. It's frequency, amplitude, volume of that signal. Which means that it's okay for things to crack twice. All right, so we're going to start right here in the middle at T6.
Okay.
Nice and gentle breathing. Good, I'm going to follow this breath down. Good, at the end of the breath, Chris, we're just going to give it a little push. That was nice. Silent, but it was in there. I'm going to lower. What's that?
I said, yes, sir.
I'm going to lower the table so I can get a little bit more leverage.
Okay.
Good, following this up to the top, T3. Good, shoulders relaxing. Good. Nice solid clunk there. Can you verify for the audience that those are cracking?
Yes. Yes, they are. That I absolutely can. If they can't hear it, I certainly can / feel it.
If it isn't fairly obvious, skinny women crack the loudest. It's just less dense. How the sound has to travel through all the density of muscle is much more dense. Muscular people crack the quietest. All right, let's see. I did this one yesterday too. Gentle breathing. You're going to breathe in, then on the out breath, I push this cycle. We'll do the next breath cycle, not this one. Right there, it should begin the exhale. Good, good. One more time, Chris. And out. Good. Much better up here today. All right, nice and gentle breathing. Gonna follow the breath here. Go ahead and take a deep breath in. Go to follow this breath cycle out and out. Good. Down here. Good. Awesome. Right on your back. Just very subtle. Yesterday we had a right short stays short, which means the left hip is the primary hip that's stuck. Good. Good. Give this a little push here on that side joint. 2 inches lateral, 3 inches inferior from the PSIS, contacting the sacrum with pisiform. Another breath in and out. Good. Shoulders sinking. We'll follow this breath cycle out here. Ooh. All right, lie on your back. All right, this one on the right side first. We did occiput yesterday. Okay, nice and gentle here. We're gonna bring this down to the side. Nice gentle breathing in, following this breath out. Let's do this. head relax, shoulder relax. This testing the function of the vestibular system. So cross your arms and then turn your head towards me over here. Good, okay. Now you're going to lean back. I'm going to help you lean back. I need you to stare into my eyes the whole time, okay? It's not romantic staring, just assessment staring. Okay, deep breath in, out. Yep, I saw it already. You have nystagmus. Okay, do a sit up here again. Sure. Assess it to the other side. Okay, turn all the way to this side. Out. Okay, good. That was going to stay right there.
Okay.
All right, so I'm going to do a vestibular correction maneuver called the Epley's maneuver. This is a modified Epley's maneuver, though. It's more advanced than the regular Epley's maneuver. So therefore, it works better, because anything that's advanced is better than simple.
Yes, sir.
I mean, someone at some point did the Epley's maneuver to you.
Which is that?
The turning the head?
Yeah, but they said they found nothing.
Yeah. Did they do that to test, to see it? Or did they just turn your head?
No, I think they just turned so they were like, they had me down, and they were like, turn this way, do you feel dizzier either way? I was like, not really, I just still feel it constant.
What kind of doctor did that?
The ear, nose, and throat, I want to say.
Okay. That's not the correct way to do this stuff. It's the medically not correct way.
And they had, I think, and then they sent me to this guy where they had me do a bunch of like air in my ear, and then turn, do that. They found nothing.
Okay, that's different. That's valid.
Okay,
I like that. Did they pour water in your ear ever? No,
I don't believe so. Yeah, just air. But that was the stuff that the ear, nose, and throat guy did.
All right, let's see here. So this was the bad side. So first thing that we're going to do is turn your head all the way to the right. Mm-hmm. We're going to hold it like this. The canals are filled with a semi-fluid kind of, so it's viscous, and it takes a little bit for the contents to settle.
Gotcha. And I apologize. What's it called? You said I had. When I was coming down, you were like,
nystagmus.
Nystagmus.
Yeah, that's just the word for your eyes darting back and forth.
Oh, gotcha.
And nystagmus is present in many, many different types of conditions.
Gotcha.
But when it's present during that test, it moves towards the side of insufficiency, which is the right side.
Gotcha.
In this case. And it may be both sides, but it was more prevalent on the right. So we stay in this position for 2 minutes. I'm just waiting for all the contents to settle. In a moment, I'm going to turn your head to the other side.
All right.
And so this is not a neck adjustment. I'm not cracking anything. I'm literally just turning your head.
Okay.
I'm going to do it quickly. And all you have to do is relax through it, just kind of like the adjustment. Okay. All right, so we'll do that now. We'll do 1, 2, 3, turn, if you want to help just a little bit. But I'm just going to go as fast as I can to the other side.
Okay.
Okay, ready? On turn. 1, 2, 3, turn. Very nice. Any neck pain or anything there?
Nope.
That was good. That was one of the quickest head turns I've ever seen, actually. And we stay at this side for 2 minutes now as well. All right, so now the next step is going to be, you're going to roll your body to the left so that it's aligned with your head. So
okay.
You're just going to turn your body towards the window. I'm going to hold your head here the whole time.
All right, tell me when.
Go ahead.
There we go.
All right, now from here, keep your chin right there on the shoulder, and now push yourself up to a seated position.
Okay.
So just come up. Good. All right, now relax your head and shoulders. That's good. All right, any dizziness coming up there?
No. I don't think so.
All right, very good. No dizziness coming up.
No.
All right, stand up and just walk around a little bit. Take a couple steps. You feel dizzy?
Not dizzy, more of like a head rush, kind of.
Okay.
But definitely not dizzy.
All right, very good.
No, definitely not dizzy.
All right, let's do this now. You're going to sit back down and then lie back down on your back.
Okay.
So we'll go back and we'll do that one more time at the end.
All right.
All right, now let's see here. All right, just give me some resistance here. Make this strong. Good. Not too much. You're too strong for that. Okay, just hold that right there, just like that. Good. All right, let's see. I'm going to do the maxilla first. We're going to
Yes,
pull
sir.
the maxilla down here. Yep, just give me you can relax your teeth.
Right.
There you go. First, this one has to go in this direction. There's 3 directions that the maxilla has to go into. It goes lateral, it goes superior, and it goes anterior. So like you're lateral to the right, and the superior and the anterior are good. It doesn't need to go that way. Lateral to the left, good. And there's 2 sides of this bone, so you have to check both sides. Good. So it's actually moving there. I have to pull it down one more time because I pushed it back up. Good, okay, open again. And then that's the maxilla is in the front. The palatine bone is further back, and you have to go across the suture, which for you is right there. And I should be just in front of the gag reflex for this. You're good. Good. No, this one's different. Good, good. Swallow. All right, we're going to look up one more time. That one's better. A little bit more over here. Good. 1, 2, 3. All right, I'm going to test the pterygoid muscles here.
Okay.
So give me a smile. Okay, relax your jaw a little bit. Is that tender in there?
Uh-huh.
To this side. Is some tender in here? Both sides?
That's super tender.
The right side?
Yeah.
All right, let's see. Do you ever wake up with a sore jaw?
Sometimes.
Oh, man. All right, I'm glad we're doing this one. That was a clunk. That happens a lot?
Yes, sir.
This side's not as bad?
I thought it wasn't.
Okay, good breathing.
That's definitely better.
Cool. Hold this arm up, make it strong, and then push your jaw over to it like this.
Yes?
Yeah, now push down against me here. Okay, now push it over to the other side. Push down against me. Okay. Did you feel a difference there? That's okay.
I could have sworn that maybe this, like when it was that side, maybe it was a little weaker, but I'm not sure.
Very nice. All right, now open again, and then push your jaw to the right. Like
Oh, sorry.
okay, now open again and push your jaw to the left. It's cracky in there.
Yeah.
We need some jaw exercises.
On that side, it feels a little cracky.
Let's see. Go ahead and open up. Close. Alrighty, nice and gentle. I'm going to adjust your TMJ and let your jaw relax a little bit. Good. And open this up just a little bit there. Good. Gentle, gentle. A little push in this direction like that. Good, just like the other adjustments. Here's following the breath. Good. Good, not bad. Good. Let this relax a little bit. There we go. Okay, that felt nice. When I pushed into it, there wasn't any hard feelings, no stuck feelings. Felt like it was pretty smooth, and that means that clunking that you're feeling is a result of ligament laxity. Sometimes it clicks because one side's stuck and one side's open.
Okay.
But there was no sticking in there, so that's our indicator that we need to do some strengthening.
Okay.
Okay, open up again. Good. Gentle. Good. Let the head relax, shoulder relax. Good. Wow, that side was a little bit different. All right, try not to open your mouth completely.
Right.
We're just gonna just keep it. Don't open it and test it out and move your jaw. Just let it settle for a second.
Okay.
And we'll see how that feels. We'll check that in a minute. All right, let me see this here. Okay, I'm gonna push down. All right. Was it terrible again today?
Much better, actually. Still a little tender, but definitely better.
Oh, this guy over here.
Same thing.
All right. Here, tuck your fingers underneath your hips here. All right. Now, we're going to adjust the thyroid. Okay, we're following the breath, and we're going to go in this direction like this. Good. Deep breath in. Tender.
Very much so.
Oh yeah, this is tight. Let it out. Little pull.
Still a little tender.
The shoulder?
Yeah.
This is the shoulders. Do you know this? The shoulder is the reflex for the
I did not know that.
iliocecal valve down here. It's okay. I didn't really start talking about it until recently, but I've done the iliocecal valve for years, but never had the reflex association with it. But
Gotcha.
like the web of the hand, the thumb finger, on the right side is the gallbladder, the left side is the stomach, and then the pad below the thumb is pancreas on the right, cardiovascular on the left. So we just use those points to monitor what's happening with the work. Breathe. A little deeper here. It's very tender.
Yes, sir.
I would get like a very low setting,
Yeah.
and then just kind of work down here below your belly button.
Okay.
Because you don't even have any food in your gut right now. You know what I mean? You're empty.
Yeah. That's fine. It's like that area right there. Yeah.
This is the iliocecal valve.
It's quite tender.
That's okay right there?
Yep. That.
Not the same over here?
Nope.
This is your at-home care.
Okay.
This is very gentle. Just kind of push down belly button to the hip bone.
Mm-hmm.
Follow from the belly button down towards the hip bone.
Okay.
Find that tender spot right there. And just hold on to it and breathe into it. Like breathe into it, my fingers. Like you're a good belly breather. You've got the belly breathing technique. Good. Take that massage gun and just go in circles like this in this motion. This is the direction of digestion.
Okay.
Goes from ascending, transcending, descending, colon. Ascending, transcending, descending, colon. I'm gonna crack your ears here.
Okay.
When I read your pulse, it suggested that you were in a grounding phase.
Okay.
I have to work on your thyroid too while I tell you this here.
Okay.
And of course, you have 2 little ones, so you're not quite nesting. You're past the nesting stage, but there's the magical time period. It could be anywhere from a month up to 5 years, just depending on the value that you place on it.
Mm-hmm.
There's nowhere to go. There's nothing to see. There's no one to meet. You have everything you could possibly need when you have 2 little children in your house. All they're doing right now is sponging up the world, and movement and interaction with nature. Simple things, quiet things. It's very grounding medicine, very earthy medicine. And it brings us into a very mysterious place, that a paradox is that this thing that we all do, and we all got here the same way, the most simplest thing, procreation, becomes the most profound teacher. That the tiniest little beings, without any academic knowledge, teach us more about ourselves than any university or any book could. That's a beautiful place to be, a beautiful stage to be. And there are many different types of grounding stages. And but the grounding stage that you're in right now, root chakra, can be accessed with the chant Lam. So yogis say Om.
Mm-hmm.
That's up here. That's crown chakra. Om. Lam, Bam, Ram, Yam, Ham, Om. Is the 7 chakras. Lam is the grounding.
Mm.
So the vibration medicine, if things start to get chaotic, if things start to get like when stir crazy is really the word, because the energy tries to move, the energy's going to want to move, and it will. But the energy to remain in the grounding state for as long as possible. You always want to bring experiences to children when they're ready, so as not to overdevelop an undeveloped mind. So the medicine for that is Lam. So you just Lam, just like you're oming. Lam. You could say that to your baby your tiny little baby, and vibrationally, they'll understand. All right. Is there anything else? Do you have any other questions? Is there anything else that you want to look at or work on?
No, it's been awesome. Thank you. I really can't say enough. I definitely feel better than yesterday when I was coming here. So honestly, you've been awesome. I really can't say anything about that.
Awesome. Thanks for that.
No, absolutely.
All right.
Dude,
So
thank you.
You're welcome, man. I appreciate the effort to get down here.
Absolutely, man. It was awesome. Hopefully, I'll get better. But I'd love to come back.